Alicia is 28 and had her third child, Freddie, 2 years ago. Today, 2 healthcare professionals are visiting her to do a checkup on her toddler. Cruz is 45 and has 9 children. The youngest, Randy, is almost 2 and was unplanned. What do these 2 women have in common? They live in poverty in Central America with limited access to basic health services. In this region, the mortality rate for mothers and newborns is among the highest in the continent. However, this situation is changing.
Before, you had to go to the health center or the hospital. It has changed because now nurses come here to tell you when you're behind in the checkups.
From what I've seen, it's the first time. They come to visit us to make sure our children are doing well. I'm very grateful because in my entire life, this is the first time they visit us like this.
These health improvement efforts are made possible by the willingness of the region's governments, who are prioritizing policies and resources, and the financial and technical support they receive from institutions such as the Inter-American Development Bank and the Salud Mesoamerica 2015. This innovative public-private partnership gives expertise and knowledge that translate into original health proposals, such as a results-based financing model that contributes to improve key indicators in the poorest 20% of the population.
The project established health results according to the evidence that we have on the effectiveness and efficiency of these interventions. Further to financing the activities, it also established an incentive that allows the government to recover half its contribution to the project if the results have been achieved.
In the end, this model will produce evidence of the impact caused by the types of interventions selected, results-based financing, and the role of innovation in providing service. This innovative model is also expected to facilitate a higher level of output and efficiency in the country's health services.
Very important tools so that the coffee producers also understand they don't just need to focus on the production of a bean of excellence. In some cases, the producer can obtain support in order to be able to promote and sell the coffee in the best possible way.
More than a year ago, the government of El Salvador decided to prioritize health by encouraging the development of a large national alliance with the objective of achieving universal, equitable coverage for its entire population.
The ministry hired enough staff to provide care, and we're providing the health care, but we need equipment, office supplies, medications, and an adequate infrastructure.
The government's efforts involve human and material resources that require a proportionate investment. However, their limited economies require support through technical assistance and investment in order to achieve ambitious goals.
These will not be long-term expenses. I think the model is structured to achieve medium-term changes that obviously will translate into tremendous savings in the future.
Commitments such as the one made by El Salvador are becoming increasingly common. Alicia and Cruz have already started to notice these changes. The reforms of their government and strong international support are changing the future for them and thousands of people in Mesoamerica. This must be a sustainable change.